So I think probably we should get started, just because I know that Dr. Raj is joining us kindly, and I want to get to her part so that she can stay or go. We'd love for you to stay, but you might be busy. So,
Leslie, so
what'd you say?
Not in the best mood right now. It's a weird day to be like,
I'm sorry.
No. I'm no different than anyone else, I'm sure.
I'm sure you're the same as all of us. Okay, so today we're going to talk a little bit about the public service minor, and a little bit about how it can hit and associated classes can help with producing projects and getting involved in opportunities. So just really quickly, the minor has 4 tracks, and the requirements are real similar to pretty much any other minor. So most minors are 6 or 7 classes. So TMC 15, which Arthur teaches, and I'm going to have him talk about in a few minutes, is an introductory course. Other than that, you just need to do 3 upper division courses that are in your track area. So I think probably for most people if they are interested in the minor, it would be in the health area. And then 12 internship units. And I really think it's the internship units that are the most important for the projects that we're talking about today, that and TMC 15. So the tracks are education, government, social issues, and health. And I'm going to introduce Dr. Anita Raj in a minute. She is the director of the health track, but I just wanted to point out that there's a lot of overlap between these tracks. So for example, the government track, we really think about that as a social issues and policy kind of track. So it's really about policies and how the government can develop policies to help with sort of all these other things. So for the relevant part to this initiative is, somebody's coming in, is the health track. So that's really about serving within the domain of health. So Anita, can you introduce yourself and say a little bit about who you are?
Sure. I'm a professor, Anita Raj. I'm in 2 departments. I'm actually in the Department of Medicine, and I'm in the Department of Education Studies. And I feel very fortunate. I was selected to get to be in Thurgood Marshall, which to me is indicative of, a recognition of the commitment we have to social justice in the work that I'm doing, which is, I think, really aligned with how we think about this health track. So with health, we think a lot in terms of disparities. We think about work that we're doing both in the United States and outside the United States. So we have a number of projects. I have a center on gender equity in health. So we focus a lot on issues of population health. So that can be reproductive, maternal, child health, adolescent health, infectious diseases. And what we really are interested in is how disparities operationalize in ways that make unequal health or healthcare access, and how do we overcome those disparities. At this time that we're all contending with the COVID pandemic, it cannot have escaped your notice that the disparities are quite substantial. We tend to see the issues of a disproportionate number of cases in our Hispanic, Latinx, Black, and American Indian, Native American, Indigenous communities. And then we see among our Black communities an even higher rate of death, even among our racial minority groups. So that's really important. And at the same time, who's on the front lines of healthcare? Well, we see disproportionately women of color. And so what we try to do is really think about how these demographic indicators end up compromising risk or leading to unequal distribution of illness or unequal access to care. And our hope is to support you all to be able to take on these kinds of issues and try to promote better public health and population health with an eye towards addressing health disparities.
Great. Thank you so much, Dr. Raj. So the other component, first of all, does anybody have any questions for Dr. Raj before we move on? We're going fast, but I'm excited about the last thing, so it's okay. So the other main component of the minor, and so as Dr. Raj was saying, is the health track is really geared towards getting students experience addressing some of these disparities. So that's where the internship units come in. But the other place that has sort of a bit of a, I don't know, opportunities for hands-on learning is TMC 15. So that's an introductory course. Dr. Atkinson teaches that course. So Arthur, do you want to say a little bit about your course and how it's structured and how it can help with students who might be interested in pursuing some of these sort of experiential learning opportunities?
Yeah, absolutely. The great thing about TMC 15 is that it kind of provides a broad overview into these different tracks, and it gives students an opportunity to explore whether or not they want to really declare the public service minor to begin with, and then what kind of areas they're most interested in terms of choosing what track they want to go to. So for example, one of the main components of our class, which is the final project that they start working on from week 2, is to build this idea that they have, and it really calls on them to use their imagination. So whether or not you're passionate about healthcare, you're passionate about public transportation, maybe there's a specific issue in your hometown that's related to public service, and you're like, man, this could be so much better if this organization was doing this, or this could be a lot different if we restructure things that way or this way. So it's really an opportunity for students to discover what it means to be personally and collectively invested in the greater good. So we talk a lot about what the greater good means. We look at some really cool TED Talks and some different authors. We explore the idea of service and why it's important to communities, and why service is actually a really important part of a vibrant civil society or a vibrant democracy. So we look at the role that service plays. And so yeah, TMC 15 gives students an opportunity to explore that side and kind of scratch different itches, if you will, so that they can decide what they want to do later if they decide to declare that major.
So Arthur, is there, do the students in TMC 15 do any of projects or anything outside the classroom? Or yes, is it more just generating ideas?
So we do a lot of projects. Well, this quarter has been really interesting because of the pandemic, obviously. So I brought in a guest speaker last week, and who came and spoke to the class for about 30 minutes. And that was really exciting. We normally would have gone to look at different organizations. So we look at the 3 sectors of civil society, which is, the public sector, the private sector, and then that kind of nonprofit sector. And I have a lot of connections more so in the nonprofit side of things. So last winter, when we taught this course, we were able to actually go and take some field trips. Last winter, the course only had 4 students. So it was actually really kind of cool because we got this really meaningful experience where students got to meet with practitioners that are working for nonprofit organizations. We had the CEO, or I guess the director, maybe I'm not using the CEO word right, but the founder and director of I Love a Clean San Diego, which is a really cool local nonprofit here that works to do environmental beach cleanups and things like that. So his name is Len. So Len came and spoke to the class. I'm going to try to Zoom Len in this quarter. Obviously, we're not doing it in person. So there are a lot of opportunities to get involved locally in San Diego with different organizations through that way.
Great. And then, so you kind of touched on this already. So within TMC 15, but also more broadly in the minor, learning about all of these different avenues through which people can serve. So nonprofits and other areas. can really help identify project topics. I don't know, is there anything more you wanted to say about that? Because if not, we can just have more of a discussion about possible ideas for projects that we could do.
Yeah, I would kind of love to hear what people are thinking about in terms of their projects for related to the health disparities, because I think most of the students that come into the TMC 15 course are, as you said, Dr. Carver, they're interested in that health aspect side of things. Mm-hmm. So I'm curious to know like what different ideas people have are, because it kind of sounds like the final project we do in our course, or the final project we do in TMC 15 is quite similarly aligned to the project that students might do for this program.
Yeah, and I'm really glad that Shibangi is here, because I think that, you know, you have a lot of experience with not just generating ideas, which is something I would love to hear from all the folks who are on the call right now, but also about turning those into action, right? So I have ideas, but I want to not monopolize the conversation. So does anybody care to share anything you've been thinking about in terms of health disparities that we would like to see addressed? And we can even start thinking about maybe the way that we would do that.
Well, I did. Can everyone hear me?
Yeah. Yeah.
Or there's like background noise. My dad's like playing jazz music. But anyway, I did talk with Leslie Carver over the weekend, and I told her about how there's an alumni that works with Migrant Health, and she is involved in an organization that primarily focuses on health disparities down at the southern border. I tried connecting with her. I think she doesn't have her UCSD email anymore, so I think I might need to reach out through text messages or something. But that is one thing that I had in mind regarding addressing health disparities is Migrant Health, since we're so close to where they are, and since we do have a person that is a part of that organization for the past, I think she's been there for 3 years. So she try to connect us with her organization, what we can do also just to educate us in general. So that's one idea that I had.
Yeah, I think that's a great idea, and obviously a huge need in particular in, like you said, the border area. Shibangi, has your group done any projects around migrant health in the past or currently?
Yeah, so we have collaborated with another student organization, the Refugee Health Alliance, and they've done work near the border, going down to clinics. And I know UCSD, faculty or doctors from the free clinic here at UCSD also go down. I haven't personally been. It was one of my interests ongoing these next few months, but obviously the pandemic changed things. But I was interested, Ivy, what's the name of this organization? And do you know what your contact, like, do you know what they do? Or
even their name?
Yeah, so do you know Pamela Escobar? I'll just type it out for you.
No.
That name is super familiar, but maybe that's because you told me or something.
I met her through an organization called Alternative Breaks. We were both site leaders in that organization. Is
that run through ERC?
That one is just CSI.
Oh, CSI. Okay, because maybe CSI could help us connect with her.
Yeah, so I did email Emily, and I copy you in the email, but I wasn't sure if I copied the right email. So I forwarded to the other email.
Okay. Now that you mention it, I remember seeing it.
Oh, okay. Yeah, so I reached out to Emily Lee, who's also part of CSI, so that could potentially, she's also willing to help us out. But she also wants to ask about more details from you, because she wants to know more about itinerary and stuff.
Okay.
So when you're free. Yeah.
Okay.
Okay, that's helpful information, Anita. So Anita just put in the chat that there's a clinic for migrant families at the border that's shut down right now. I mean, I think that this brings up the whole question of the pandemic as well. So Dr. Raj mentioned it. It's clearly affecting this migrant community if a clinic has to be shut down. But so that's where my mind immediately goes when I think right now about health disparities is there a way that we could do something to provide just even a small amount of support to communities that are affected by the pandemic disproportionately?
So I was talking to a student from also alumni who's involved with the Intersectional Health Collective.
Mm-hmm.
They're an organization that sounds pretty similar to our organization. It might be Interdisciplinary Health Collective, but it's IHC, I believe, a student organization at UCSD. And I heard, I can get in touch with her again. I heard that they were setting up like telemedicine at the clinic there. I'm not sure if it's this particular clinic that Dr. Raj mentioned, but they're setting up, they largely set it up and they're getting that going. So that could be an option we can explore, figure out how that's going and see if we can.
What kind of, Shivangi, in your experience, and this, obviously your experience is not in pandemic times, but what kind of things could students who want to be involved in something like this do to support an effort like that? Like, is there ways that students can help with even just like lining up appointments or any of those kinds of things if we're able to connect with somebody who does that sort of telemedicine stuff?
So, I mean, largely in the past, it was actually like volunteering, going down with students from here. But I heard, I heard recently, they need help with translating, translating to Spanish, material from English to Spanish. So that's something we could help with, whether that's in volunteering sense. But in terms of student projects, I think it would be helpful to maybe set up a meeting with representatives from there.
Yeah.
To learn more and figure out what the need is and then create a student project based on that need. But yeah.
Okay, that's great that the Dr. Raj put a volunteer website in the chat, so that'll help as well. So, I mean, maybe if we can get a hold of them and if we can get a hold of Pamela, that might be sort of a couple ways we can explore helping out with that migrant community and kind of tackle the virus situation as well. Does anybody else have any other ideas though? I'd like to hear from Kyan or Jenny or Maria or Ashley or Ario. If any of you have any thoughts or ideas or things you'd particularly care to or be passionate about working on? Putting you all on the spot.
Hi.
Hi.
So I don't know how like this would work like in relation to this, but I would like to, what's it called? I think it's one of the classes where you go to like a student-free clinic. I think it's a global health class, I'm pretty sure. But basically it counts as a 4-unit course and you go and do clinics like twice a week in Mexico. I don't think they're doing it right now during the pandemic, but after, I would really like to do that.
Do you know if that's through academic internship program maybe? Because I know that you get course credit for doing that.
I need to look for it. I honestly, I forgot the name.
Okay.
But I can let you know when I figure it out.
Oh. Anita knows everything. Yeah, that would be great. I mean, I think that's really relevant to this whole conversation that we're having about migrant communities, and then also just south of the border, and just even being in the border region, and the importance of
the migrants are hard right now because the border is so shut down.
Mm-hmm.
So but at the same time, so this I know more just because my appointment happens to be in infectious diseases.
Uh-huh.
So I get to hear more about it from that. So a lot of the patients we have in San Diego or, at UCSD are actually coming from south and east of us. The pandemic is much worse there. And so, it goes both ways. I don't really understand the nature of the volunteer work that's happening, but my guess is there are some ways they don't want you in hotspots, and in some ways you can help. But the need seems to be more, and it's not really the migrant community, I would call it more the border community. Just for right now, until the border opens again. Yeah. I will say that UCSD was really amazing. I was very proud to be a part of UCSD with seeing the work they did, with when families were getting separated, they just really, what San Diego did was amazing. It's a wonderful place for students to get to work. I saw lots of our students there, but it's shut now, sadly.
Yeah. It'd be great if we could think of things we could do while things are shut, just because I think that, there's obviously still need, right? And
border community
more difficult. Yeah.
I think these two sites have open opportunities. So the Hands on San Diego, they should be able to help. I only know that these are like reliable sites to go through. But, I don't know if there's a way, because this one I noticed in Hands on San Diego, I just need the name of the organization because I know they do COVID, but it looks like the students could potentially organize if one of you guys wanted, or if you wanted to look together to see, and then come together as a group to reach out to them, and then ask if you could be doing it in the border area.
Mm-hmm. Yeah. And really the goal here is not to have students do like individual projects, but maybe to coalesce around something a few or all of the students are mutually interested in, and working together as a group on those projects.
And then the homeless community here is just that, we're just in a crisis point. So I think between COVID and the homeless, like those are really important ways to meet needs while we await opportunity to work with migrants again.
Yeah, I think the homelessness thing is a really important consideration. I don't know about status of the pandemic among people who are without housing right now, but I know with respect to other infectious diseases, it can get really bad just because of sanitation and that kind of stuff.
Reed, I think the thing so this is weird, and I there seems to be mixed evidence on this, but there's some indications that there's somewhat lower risk. And people are trying to understand why that might be, because it doesn't really make sense. But like, the way we hear about things in the nursing homes, we have not heard in the homeless shelters of outbreaks like that. So I think that's still up in the air, but I think substance use is up really high, and that's a really pressing issue, and mental health concerns. Mm-hmm. So, I don't think of like, when we think of how to deal with the COVID pandemic, I don't think we have to just think about infection, although certainly that the mental health needs are substantial right now.
Yeah, and it doesn't need to be, thank you, Maria, for putting that in the chat. It doesn't need to be around the pandemic, obviously. That's just sort of where my mind went first, but there's all these other needs, like you're saying, among homeless
people. I think you're right, though, Leslie. I think that these are all pandemic related, and I think that it's meeting the immediate needs that the pandemic has given rise to is enormous.
Well, and I think also we might have more people in that situation of homelessness because of the pandemic, because people are losing jobs and sources of income. So.
Yep. And falling into debt with healthcare issues too.
Ario?
Yeah, so Dr. Raj brought up mental health, and I was actually just looking I found the PDF actually for where that slide that was presented with all the statistics, where they got that from. I found the .gov PDF of it, and I was just reviewing it again. And I noticed that the two biggest areas to me that I think are most relevant right now, especially during the pandemic, are the communicable disease and the mental health. And in terms of communicable disease, I'm seeing right here, fluid pneumonia is through the roof in the lowest income bracket and the second lowest income bracket. So is chlamydia, interestingly, but those are like very high. And then if you go look at the mental health bracket, you see right here that there's a lot of alcohol, substance abuse. There's a lot of schizophrenia, mood disorders, all of these types of things. I'm seeing anxiety.
Are you?
It's pretty big on this chart.
Are you trying to share your screen?
Oh no, I'm not sharing the screen. I'm just reading the data basically.
Yeah. Could you maybe put that PDF into the chat? Do you know how to do that?
Yeah, I do.
Really helpful. Okay, sorry. So continue.
Yeah, but my major is neurobiology, so I study the brain. So, mental health is something I'm obviously very passionate about too. So I think definitely the way the pandemic has affected people in terms of their income, their housing status, maybe their marital status, et cetera, all these relevant aspects of their life and even in their health physically, it also will burden them mentally. And then it's no surprise that, you're going to have a lot of substance related abuse, which will also exacerbate mental health issues as sort of a domino effect. So I think if we can find a way to do that, that would be really good. And I think it's also more feasible because I'm also looking at like the marital, the birth rate statistics. And while I think they should be addressed, I can't really think of exactly how we would do that right now or how, but, and then the non-communicable disease, I mean, those are there. But again, I think the most relevant things to address right now with the pandemic is the communicable disease, COVID-19 obviously being one of them. And you have flu and pneumonia and all these things. And then mental health, how, just the situation of life right now is affecting people. And let's not forget, besides all the other points we addressed that affects mental health, just isolation drives people crazy. That alone it can degrade mental health for a lot of people, depending on what's going on. And
yeah, no, I think those are all really, really good points. And I think it would be useful to maybe for us to do a little bit of investigation on whether there are like nonprofits or other groups that might try to address some of these issues where we could potentially volunteer. So that's exactly what Shivangi just put in the chat and Ivy agreed with, right? Do some research on what the organizations are and then we can connect with them. So that might be a really useful thing. And then even try to invite those groups into the public service fair that we're talking about having the beginning of next quarter.
Yeah, exactly. Because at least with my experience with IHP, we definitely don't want to reinvent the wheel, like start from scratch or recreate resources that are already there. I think there are a lot of really good service organizations in the community doing great work. And if we could connect with them, we get to learn their experiences and their connections. They already have connections with populations that we're trying to reach. So we can learn from them as well as try to figure out what exactly. So with that idea, if some of us want to focus on mental health, we can, of course, like first research these existing organizations, but then from that, what do you all think would be a like project in terms of like what could we do? Is our goal to increase access to these mental health resources, or what other ideas do you all have?
Yeah, I think that's a really important question because, and I don't know in your experience how much that goal is directed by who you find to partner with and things that they're already thinking about doing. So, I mean, I certainly think access to any kind of health is really difficult for people who are in some of those situations, whether it's being immigrants or being homeless. Are there other things that people can think of that we could sort of target as a project?
Well, I'm not sure how it would work as a project idea, but I think one thing that I feel is that, everyone, when they want to address mental health, they always say like increase resources, resources, resources. And that's relevant, of course. Mental health resources definitely do help in many cases, but sometimes people use those resources and have access to them and they're still suffering. I mean, there's only so much it can do. And I think one thing that really can help a person a lot when they're going through something mentally and when they're burdened with some mental health issue is just companionship, just knowing that someone cares about them and hears them and understands them. I don't know how that would work in terms of a project, but I think in addition to resources, maybe we should just find a way to reach out to people and just enrich them in some way in terms of like, some sort of companionship, friendship type of thing. I don't know. What do you think of that as well?
Maybe I think up like a pen pal system or another. What were you saying, Dr. Carver?
Oh, I was going to say something a little bit different. So, yeah, I mean, I think that particularly if we're able to identify a group that does something like that, I think that just feeling supported is really useful. This is I'm a psychologist, but this is a bit outside my wheelhouse because I don't really deal with mental illness as much. But I think just in general, having a support system is useful for almost everybody's mental health. The thing that I was thinking about has just completely evaporated from my mind. So it'll come back in a few minutes, but keep talking. Oh, the other thing I was going to say is I was thinking about the intersectional health San Diego group that Shivangi has been a part of. And one of the things they do is they do informational things, right? So they'll do research and then they'll inform the community about, for example, what problems there are or what resources there are. So that's another thing that we could think about, is even just like whether we could do some kind of a project to almost publicize the problems and the resources that are out there a little bit more.
Exactly. Ashley actually heads that journalism team that we call it. If you wanted to add anything, Ashley, to that.
Oh yeah, I definitely agree that that's really important, because I think, well, you have to find a background on certain issues before you're able to come up with a plan to tackle them. And some of the things that I'm trying to work, like in trying to learn how to be more activist and things like that, is that sometimes I do feel like you have to research issues and then, lobby or encourage people to act politically and vote, because that's the best way to solve an issue. So yeah, it's the way that I think about things sometimes.
Ario, is your hand still up from before, or you have something else?
Oh no, I didn't raise it again.
Okay. Any other thoughts?
I have one thought just to add, which is that so you can get the data and you can find out that mental health is quite a major issue, but when you go to the community, ask them what their needs are, they won't say it's mental health. And so then there's sort of that, like, are you really respecting what the community wants if you just go in, but are you negating what a community has indicated that they need if you don't do anything? And some of the ways I've seen, I'm on a project where in India, and they need to go out into the community. They wanted to do door-to-door assessments to understand likelihood of infection transmission in the rural area. And so they actually had the health workers go out and do it. But to go door to door, it feels stigmatizing for them to go to the door. Oh, you think we have it? You think we're doing something bad? Or not following rules. And so what they did was they went door to door in a health role, as if they were doing your basic preventive medicine service. They were offering family planning, they were checking on children, and that's how they did it. And I just bring that as an example because sometimes instead of saying mental health, you work hand in hand with, let's say, a food security program. Because people are really clear when they need food. They understand that that doesn't feel so stigmatizing. So as you think about going into a community, I think there's the combination of really working with the organizations to see what do people say they want, and then connecting in ways that feel safe and gentle. Because I think as Ario, I think social support is huge. We know that from like Meals on Wheels, that Meals on Wheels gives food, but it also gives social contact. Mm-hmm. And that was huge when gas prices went up and people couldn't do them as easily anymore. It was a huge emotional loss, not just a food security loss. So just sort of thinking, when we think about disparities, just it's very, you go really holistically to think of your solutions.
Yeah. I would just add to that, there's this concept of hierarchies of need and how it's easier to deal with any issues you have around mental health or something if you have your basic needs met, right? You have food, even if you don't have shelter, et cetera. So that's something we're thinking about. Jenny?
Yeah, I had just a brief idea regarding spreading information in relation to mental health. I think it may be a good idea if we also reach out to the families of those victims of mental health, and by providing them with strategies or methods to further support them, because we may not be able to be in contact with them for a long time, but the families will be there for them throughout their lifetime, and just understanding what their victims are going through. I think the family can just listen to them and again, reinforce the companionship as well.
So maybe that's another sort of research project, right? Is to see if we can identify any organizations that do that. And I think that's a great idea, is to support the families so they can support their family members. Great. Maria?
Hi, so I actually wanted to touch on two topics. First, I think that what they said, I don't remember who it was. They said that we have to approach people holistically, because some communities, or I think in general, there's a certain stigma. I'm sorry if you can't hear me. There's a certain stigma around mental health, and a lot of people don't admitting it, that they might be going through things. So kind of finding out a way to approach it in a way that they don't feel I don't know, in a way that they will kind of admit how they're truly feeling.
Kind of like what Dr. Raj was saying about going to the door for some other reason and then sort of getting to people that way.
Mm-hmm. And I also was thinking about COVID in general. Well, it goes beyond COVID, but now that everybody's at home, there has been a lot of domestic violence too, which can also really impact health in general. And like Ashley said, if we were to partner with mental health hotlines, it would be, I think, very beneficial.
Yeah, I think that's a great point. And another area we could definitely look into. So does anybody else have anything else? Because I feel like a good use of the last 15 minutes would be to sort of, I don't want to say assign, but kind of assign people to research that we could do and things we could start looking into. So things that I wrote down are migrant health access, homelessness, COVID disparities, other things that are sort of peripheral. Thank you for coming, Anita.
Thank you, and I'm sorry. Okay, but let me know if I can do anything.
Yeah,
Bye-bye.
we will. Thank you.
Thank you.
Peripheral to the COVID crisis, basic needs, food security, domestic violence, Does anybody have any other things, and does anybody want to volunteer to sort of take a look at looking into whether they can find organizations that deal with any of those issues?
Yeah, well, I was going to say, first of all, that as far as what Dr. Raj said, I definitely agree that you have to do what the community is saying that they want. I wouldn't want to go there and just sort of kind of like be like, yeah, we you might think you want this, but we know this is what like, you can't do that. I agree. You have to do it holistically and in a very gentle and sort of non-intimidating, confrontational way. So and I was actually going to bring up the hierarchy of needs too. So mental health definitely is going to improve a lot if you have your basic needs met. I mean, sometimes you have your needs met and you're still not mentally there, but in general, with these communities that are struggling financially and whatnot, definitely if they have a load taken off their back for lacking these sort of basic necessities and care, then definitely they will feel better in their day-to-day life. So I think the first step is just identifying what the community wants and then going from there. So that would have to be the research that needs to be done. We'd have to see what the community is actually wanting.
So what's a good first step in that? I'm going to kind of look at Ashley and Shibangi for that. And Ashley added about Native Americans and the COVID situation, which is, I think, really important. So you have expertise in doing this, trying to figure out what the community wants and needs.
Before that, I'd want to add on to Jenny's point. I liked her idea about reaching out to families of victims of mental health, dealing with mental health things, because they're their long-term support. So along with that, I think we could also, if we decide for one project to go the information route, sharing with families, I think the symptoms of different mental health disorders or issues, because I think a lot of times families can be the first one to recognize the signs of like a bigger problem or bigger. So looking at those or like making aware of those symptoms, I think raising awareness about those symptoms, I think could be a route that we can go also with that project.
Yeah, that sounds great.
And then about first steps for what we have like all these ideas. I love all these ideas. I think first step we can go with all of this is like you said, definitely researching. Maybe we could create like a Google Doc with these ideas and then list under each idea like potential organizations we can collaborate with. And then that way we can also split up the research that way. And then from there, I think when we decide to actually connect with these organizations, we should have some ideas in mind for what exactly we can do, and then be willing to listen to them also for what they think we can help with. And then down the line also, we could try to schedule interviews, maybe through getting contacts through these organizations and hear from actual people about what they would like to be changed or done.
Yeah, I think that's great. That's really helpful. So I love the idea of making a Google Doc. Hopefully, I think I've got adequate, I wouldn't say good, but good enough notes. Another thing that I thought of was if it would make sense for us to sort of make a spreadsheet or something where we kind of put all these ideas of possible topics and have people kind of upvote or whatever the ones that they think are the highest priorities, so that we can narrow down the topic a little bit. That would be great. Maria, did you have something, or is your hand up from before?
No, it was from before. Let me take it off. Yeah.
So I think the biggest thing, hold on a minute, I'm going to do something for us to think about doing, like sort of right now, is committing to that. We're going to take a look at a spreadsheet and do some research and then just enter information that we find on it. So can I get a thumbs up from people on doing that? Because I'll do it. I just don't want to do it all by myself. Well, I don't even mind doing it by myself. I just don't know if I have time. Thank you, Jenny. All right. Thank you, Shivangi and Ashley and Kyan. Thanks, everybody. I really appreciate it. So I'm really excited about this. I think this has been great because these are some great topics, and I'm going to get, I'll get something up and I'll share it with everybody. Maybe not today anymore, but maybe tomorrow. Okay. Anything else before we close out?
Awesome. So maybe we can all commit to adding some links to these organizations on the Google Doc.
Yep.
And then trying to upvote on that spreadsheet what topics you're most interested in.
The other thing thanks, Ario. The other thing I was going to say is if you go back to the very first meeting we had a long list of partners of that San Diego Health.
Live Well San Diego.
Live Well San Diego. So just because we're not able to partner with them right now doesn't mean we can't partner with their partners. So that might be a good place to start. And I think that recording is up somewhere.
I think it should be it should be up on the Marshall 50th website soon.
Yeah, no, I think it's up there today, and it's going to go on our YouTube in the next day or two. I think that's true. So that's a good place to start if you're thinking about looking into stuff, and maybe, pick organizations that deal with things that you're particularly interested in or passionate about. All right. Thanks, everybody. It's nice to see you all.
Thank you.
Bye.
Thank you. Bye.
Thank you. Take care.
Thank you.
Oh, okay. Bye.
Bye.
Bye, Shivangi.